So this is where we talk about the CWIS principles a bit, and this will support my presentation on how we approached Kampala to make sure we try to address some of these critical principles. So the first one is really on equity and safety across the entire city. So looking at the organized urban space, the informal settlements, the vulnerable groups, everybody benefiting from the citywide sanitation program. The second one, of course, I wouldn't emphasize it more. I know most of you have spoken to it, the gender aspects. And this is not about building only toilets. I like the program in, I think, India, where one of the cities of building the she toilets. I really loved this idea. But so it's not about providing toilets for women. Participation in the decision making, getting involved in the planning, the designs, getting involved in the appropriation of resources. So it is more than just providing for them. They need to be part of the planning. Also looking at the number 4 is critical. Which institutions have which roles to play in the urban space? This has to be clear to ensure accountability, responsibility, and reporting. And of course, planning, both strategic and action planning. So ideally, every city should have a strategy as well as an action plan. And the last one is not just least important, but probably the most important. You need the political will. So putting these principles in practice, we tried to prioritize a few blocks. So of course, one is to ensure that we developed citywide infrastructure and services where we are not only focusing on the public, but also the private sector, and bringing also development partners in that space. So before, we found everybody doing their things. So we needed to restructure that system. So an NGO coming in space should fit into the picture of the city, not what they wish to do. And of course, informal settlements form a bigger proportion of the city, and therefore we need to focus a lot there. If you address inequalities in informal settlements, then you will have a bigger milestone for the entire city. City-specific policy, so you have the national, but you need to translate these into local. So that was also important. Of course, gender and knowledge management. And as you can see, we are also sharing. And as you share and you benchmark from others, you learn, you keep improving your own systems, as well as sharing what you are doing. So we begin with the institutional. So there was a bigger reform of the city institutional infrastructure and institutions. So one of the intervention was to establish and revamp the City Public Health and Environment Directorate to make sure that sanitation and other elements of public health are dealt with holistically. And you can see that here, what we did was to have two major divisions. So there's sanitation and environment, which I was heading, that included solid waste, environmental management and pollution control, public health and education, water and sanitation, where CWIS and FSM were structured. So you can see that we also had a linkage with our health. So for example, right now, you have a lot, during COVID, you have a very strong synergy between the environment, sanitation, the WASH, and the medical response. To these two move hand in hand. So this was done, and also we made sure that we recruit competent staff to fit in there, very young people, young, energetic girls and men and women to learn on the job as well as delivering the mandate of the city. On the governance aspect, we had to bring the mayor. So you have the metropolitan Kampala, and you have different, these are geographical municipalities, but we needed to move as the whole metropolitan. So we needed to bring all mayors together, and because sanitation services don't respect boundaries. What happens in one municipality influences the other. So we needed to bring these mayors together. They signed a memorandum for networking, and we prioritized certain collaboration, prioritizing WASH, mobilizing communities. And this framework is also doing a lot of work during COVID right now. They are leading the campaign. They are basically putting sanitation as part of the priorities for their political agenda. So that was so the governance structures in there. You have committees, you have working committees, you have budget committees that support the whole CWIS agenda. The other coordination, so trying to coordinate all partners, the NGOs, the private sector, the utilities, so that you are on the same page. You identify policy directions together, plan together, technical decisions. Okay, sorry, there was an interruption. But okay, so financing and investment decision. So I will give you an example. We said, okay, if we have public financing from the city, where do we put it for infrastructure? Do we construct household toilets, public toilets, or toilets in health centers and stuff? So from the beginning in 2012, we said we have to begin with our schools, where our children, most vulnerable children, funds were directed to schools, and all development partner support funds were then all households. So for us, we knew this money goes to a certain area, and that's where we prioritize. So it is important to sit together, coordinate, and this is a city coordination forum platform. We talked about planning again. So it's not just about the strategy, but also action plan, which is, so you have a long-term strategy of over 20 years. So this was one of my last assignment in the city, to have this long planning. But before this, we had action plans, so annual and biannual planning. So then eventually we decided to have a long-term strategic plan. And for each of these, you have broken down action plan. These are evidence-based planning. So we did a lot of work. We have a citywide sanitation database, so you know where you want. It was to eliminate open defecation and the unimproved facilities by 2030. That is where the focus is. So any efforts towards that is the priority. And this is being broken down into annual plans going forward at a city level. Regulation has been talked about. Capacity, you do not have regulatory instruments as well as enforcement mechanism. So we also put this in place for the first time in Uganda. We probably in East Africa, you have a city level sewerage and fecal sludge management ordinance. This is at city level. Even when we have weaknesses at national level, we do not make noise about national level issues. We need to deal with our city issues. So the city was taking lead to actually guide the national debate on having. So right now they are pushing the policy, and it is being informed by this intervention. Is pushing increasing connection. People like sewerage infrastructure, but the connection never happens. Regulation of private sector, putting minimum standards for on-site sanitation in place. I saw the professor as a city we championed this, and it is being cascaded throughout the entire country. So now they are developing the nation. So what you see here is initiatives at city level inspired the ministries to actually start now working on national level aspects. So a city can be a flagship, can be a champion of innovation, and that's what we were doing. We were trying to do. We talked about the whole chain approach. I will not go through all these, but and again, Prof really detailed this. So we looked at a technical level. We looked at the whole sanitation chain. What are the missing pieces, and what are the priorities? So at household, I mean at capture, it was important to have minimum standards, and we've also adopted the ISO standards right now. So you have a main standards that people can look operators and entrepreneurs to provide these services. And these are being these as well. And all especially in public spaces. So for transport, it was mainly looked at as a business, a private sector-led service. So all efforts were done and have been done to really promote private sector. And the utility, together with the city, worked out mechanisms to ensure that we have increase in sewer network and treatment capacity. Because of the programs at the city level, you realize that the existing facilities we are getting full within even less than a year. So we started working tirelessly to increase this capacity, and right now I think it is increasing. So when we started, we had a capacity of about 400 cubic meters of treatment capacity for fecal sludge alone. And right now that has doubled. So because of that effort. And then innovations in resource recovery. So these are some of, I will again not go into details. I want to really get questions and interactions from you. So for household sanitation, as we said, it was promoting minimum standards, innovative marketing services, and also providing some subsidies to the poor of the poorest. And these subsidies were basically to construct toilets that can work as models in those communities, so targeting the vulnerable poor. And secondly, to support the Mansons to learn on how to build some of these toilets. So translating the minimum standards on paper to practice. This is what the approach was. And right now, this is being scaled up on a citywide level. School sanitation was a big priority, and this was one of the priorities for the city investment. So in terms of pupil stance ratio, for example, by 2012, the stance ratio was 118 to 1. So 118 children, you can imagine, competing for one stance in a school in the morning. And because of that focus, by 2020, we had reached 45. So deliberately targeting that. And each year we had targets. And we're using a mix of technologies. One interesting one was the biogas. And because of this, the strategy, you could see that you could actually easily mobilize financing. For example, we approached one mobile company, telecom company, and ran a campaign of a marathon in the city, and we were able to mobilize financing for building biogas toilets for over 20 schools. And these schools have reduced their energy use by over 50%. And the children are accessing very decent toilets, much better than what they have at home and what they access in markets. And this has a spillover effect over the whole city, increasing demand for safely managed toilets. We are also doing public toilets as a priority, so I'll not spend much time on that. I talked about the sewer network. So we realized that, again, following the CWIS principle, that it was not realistic for Kampala to have even 50% of the city sewered by 2030, the SDG deadline. So we prioritize the sewer into CBD, especially making sure that CBD is 100% sewered. So that is the focus. And that's why you see that the target is 30% by 2040, and making sure that where the sewer is, there is connection, except especially the commercial and industrial and the business premises. And then we are also looking at, the professor talked about the decentralized. So here we are looking at condominium sewers. So these are under pilots in 10 areas. And then micro fecal sludge treatment for smaller communities. So these are some of the decentralized approach that we are taking. So other innovations, again, on sanitation marketing, here you see the call center, the mobile apps for tracking, these promotions to promote private sector across the entire city, using existing leadership structures to buy into the vision of the citywide CWIS campaign. Or a mixed approach, but with a very clear target of achievement, is basically what we are talking about here. I've talked about private sector, so I will not spend much time on this. But for private sector, really, the focus was on capacity building and regulation and ensuring pro-poor service. So this is where the public financing, blended financing comes in to support the urban poor communities, as well as work with the private operators to offer this service instead of using the public service. Yeah, these are some of the instruments and the incentives for pro-poor support. In summary, at a city level, you need political and technical leadership support. So these should own the vision to sell CWIS. If that is lacking, then you will keep doing the same things again and again, and there is no ownership. So you also need a vision. Where do you want to go? And what are the targets? And what are the priorities? Technical capacity is important, and I think this is why this initiative is really great. And also public participation, engaging the public with very innovative marketing campaigns. So you don't put up a campaign in 1 year and run it for 20 years. You know, just imagine you are selling Coca-Cola, for example. So for us, we took that approach of the business marketing. So every year, every 6 months, come up with something new that triggers a certain impact in certain targeted communities. And building donor confidence is important. We have to be realistic. Sometimes, of course, always, public financing is not enough to achieve your goal. So you need donors, you need partners, you need NGOs, you need private sector investment. They must see that you are transparent, you are efficient, you are accountable, and you can demonstrate results. And this is how we were able to attract a lot of corporates to support our CWIS agenda. And of course, private sector participation. But private sector is there to make money. So you need to demonstrate to them that there is business, there is demand, you share the risks, you know. For example, informal settlements, there is probably less ability to affordability. How do you bridge that affordability gap? So as a city, we could chip in with a few subsidies and making sure that the obligations are right and there are incentives for these private. So it's not about regulation, enforcement, but there are incentives to actually invest in this sector. Otherwise, they will take their money elsewhere, probably where there is even more profits than the sanitation.